So what was it like, day in the life of a doctor?
It was very busy, very stressful, and I can appreciate things a lot more.
Yeah? Morning guys, I'm Siobhan, a second-year medical resident. In the past, I've done a video where I shadowed a nurse for 12 hours, and it was a fantastic experience. I learned so much. Today, there's a nurse named Ashley who's gonna be following me around, so we'll see the opposite view. Plus, it's Resident Awareness Week this week, so gives you an idea of what we residents actually do. So this is Ashley, and so she's gonna be joining us for the day, and I just wanna get your insights. So if there are moments when you're like, man, I never knew this, or oh, I totally knew this. Like, I just want you to tell me all the thoughts going through your head.
Sounds good.
All right?
Yep.
Excellent. So here's the medical team. Our attending physician, 2 medical students, 2 junior residents, and me, the senior medical resident. We start the day by discussing a general plan for our patients, identifying who's the most sick and who's doing well and can maybe be discharged today. Okay, we are done, so that's kind of the dividing up the list part. Now we've got a plan for the day. We're gonna go down with the staff physician, check out the new patients down in the emerge, and then we'll come back and try to see as many patients before we have teaching at noon.
Sounds good.
Good?
Let's do it.
Yeah, it's a lot of talking in the morning, eh?
Oh yeah.
It's a lot of talking. Here we go, to the emergency department to see the 3 new patients who were admitted to our team overnight. One patient has pneumonia and is still requiring oxygen. Another has a cellulitis infection on their leg. And the last patient came in with chest pain. Okay, we're running a little bit late. We're heading to the multidisciplinary rounds now. Yes. Multidisciplinary rounds is a time where all the allied health professionals get together and discuss patient care. Around the table, there's a physical therapist, occupational therapist, social worker, dietitian, speech-language pathologist, recreational therapist, spiritual care worker, community support coordinator, and nurse manager. Each person plays a critical role in preparing patients with a safe and successful discharge from hospital. So, it's now been 3 hours since we started. What's the experience like so far?
We've done a lot of running around.
Yeah.
We did get to see quite a few people down in the ER. We've met with the multi-D team, and a boatload of people have come up to you and asked you for several things, and you haven't had a chance to sit down and actually take in everything about all of our patients today.
That's true.
And develop a game plan. So we're gonna go do that now.
Yes, we're gonna try to find a computer, but that's the thing, yeah, like I've had my little check boxes on my list have just grown and we haven't had a chance to check any of them off. So, okay, let's do that now.
Sounds
good. Plan. Okay, so gonna actually take a moment to try to get a couple of notes done and do a little bit of work on the computer. Cardiac exam revealed a normal S1 and S2 with no extra heart sounds or murmurs.
Siobhan,
Yeah.
you know, the patient in room 7 is supposed to be going for his CT scan later on today?
Yeah.
Just wondering where he's getting contrast, whether he should have some IV fluids around the time. I know we're being very careful with that.
Oh, that's a really good point. Okay, so the evidence about it's not always clear. So we probably actually need to discuss it with him and if he wants to take that risk or not.
Okay, sounds good. I'll have a chat with him and then we can go from there.
Let me know what he says. Okay,
Okay.
that sounds good. All right, thanks. Right, cardiac exam. Elevated JVP at 6 centimeters, bilateral.
I'm so sorry to bother you. I just have a couple questions.
Yeah.
Mr. Smith in room 3, he's been complaining of a lot of pain.
Okay, fair enough. You know what? I'll swing by in just a little bit, but
Sure.
I think that's so reasonable.
Sure.
Yeah. Okay.
Great.
Thank you.
Thanks.
Yeah.
Bilateral pedal edema.
Hi. I have a question
Hey.
about my patient.
Okay. All right. Sounds good.
Thank
you.
Okay.
Right. Respiratory exam revealed bilateral crackles at the.
Hey Siobhan, I have a patient who hasn't had a bowel movement in 5 days. We tried the Senecot already, but that's all they have on their orders.
Right now.
Perfect, thank you.
Okay. Thanks. Man, okay, what? That's been like, thought that would be like a 2-minute note that I was trying to write.
I cannot believe how many times you've been interrupted by all the different areas of staff, and you've had to quickly flip to each patient in your head. And,
That's
you know,
true.
out of 30 patients, I don't know how you keep all of them in your head the entire day.
Oh, thanks, Ashley. I don't know. There are some days where I don't think I'm as good at it, but to be honest, I like being part of the action. Like, I like being here and having people come to me, because then you're up on what's going on and you feel like very much part of the team. So I like it, but sometimes I'm like, I just want to write this note. Like, oh my gosh, it's taking so long.
Note has taken you like 2 hours.
Yes, exactly. It's so true. Okay, the morning is complete.
Yes.
At least our patients have been discharged. And now we're going like 30 minutes late for teaching, but to teaching nonetheless.
Gotta do what you gotta do.
Exactly. Okay, just finished teaching. Now we're much better at x-rays. But in all seriousness, what's left to do today? How are things going?
I just have 2 more of my people left to see.
2 more to see?
Floor ones because I was down in CCU this morning.
Okay, how are things going, Jewel?
I also have 2 patients to see this afternoon, one of whom went to the operating room for a procedure yesterday, so we'll see how he's doing.
Awesome. Okay, Ashley, you're good?
I'm good.
We're hanging out?
I was just undercover, but
Yes.
I'm good.
Okay, excellent. So plan for, I think 3 o'clock will be good. And like worst case scenario, if we make it 3:30, should be okay.
Yeah.
All right, excellent. Let's do it. Is the style of teaching what you expected, or?
Well, with nursing, it's a lot more hands-on teaching that we
Right.
would see. And with the teaching for you guys, it's a lot of like quizzing, being put on the spot. These poor med students today, like every 2 seconds, it was question, question, question. What would you do here? Or what would you think of this? Or do you think this is a great route to take with this patient? And
It's true.
if I were in that position, what I saw today, I would be sweating profusely and being very nervous around all you guys. But if they didn't know the answer, it was totally okay.
Yeah,
because
yeah.
you guys are always looking for teaching moments, and you make examples of it in good light, and I don't think anybody really feels incompetent.
Yeah, because at the end of the day, if the med students knew all the answers right away, then what's my role, right? Like, I'm here to be teaching and to be bringing some of the educational piece throughout the day. So yeah, definitely med students, you're not expected to know everything. Don't stress about that. All right, so that note is done. Next, we should go and see this patient here. We need to do a volume assessment on her.
Okay, what's a volume assessment?
So a volume assessment is when you look at how much fluid is on someone. So are they looking dry? Or do they look like they have too much fluid on them? Like how much volume is literally how much fluid volume is on them. So this person has congestive heart failure, and so they'd be volume overloaded, right? Like,
course.
yeah. So you guys always see that, but I don't know why we always call it volume assessment. So that's what we're gonna do.
Okay, perfect. I brought you this water because you don't eat or drink at all throughout the day. Practice what you preach.
Thank you so much. Oh my gosh. Yeah, not by choice, just because things get busy, and then, yeah, we should be eating and drinking more. I agree. Okay, so off to see the next patient. Okay, so just went to see this patient together, and it was so great having Ashley there because immediately her nursing instincts just kicked in, because we walked in and the patient was really like short of breath, huffing and puffing a bit.
Yeah, something didn't look right.
Something didn't look right. I know, and as I'm going and talking to the patient, checking the pulse. Immediately, Ashley's got the oxygen probe on. She's like looking at the oxygen, bringing it up. Like, it was such a teamwork moment. I wish you were always there with me.
Wouldn't that be great?
Yeah, actually, teamwork makes the dream work.
I agree. For you, Siobhan, that you do have really, really good bedside manner. And just for you going forward for the rest of your career, I hope you don't, forget about that or lose that aspect, and just maintain it, and it'll do wonders for you and your patients. It really shows that you do care.
Well, thank you so much. That's incredibly sweet. I definitely hope I never lose that. That's something. But it's not the first time I've heard this, and so you start to wonder what happens. Is there something that happens where it doesn't come across the same way over time? So, yeah, really hoping that never happens.
Don't lose it.
Yeah, so if you look over here, like the creatinine over time is actually getting a lot better. So, I don't know, I think we're actually okay with the amount of Lasix we're giving.
Hey guys,
Yeah, doing good.
we're in the other room ready to round if you're done as well.
Yeah, okay, sounds good. You guys are done seeing all
Yeah,
your
we're all
patients?
ready to go.
Okay, perfect, let's do
Okay.
it. Hey, this is Siobhan, the SMR, returning a page. Okay, great. Thanks so much. Oh my gosh. 4 consults. It's like turns 5 p.m. and the night is starting. Yeah, so 4 consults right away. We'll head down to the Emerge, and we'll also meet up with the other resident who's on tonight.
Okay.
We do not have to do all the 4 on our own.
Perfect.
But we'll at least get one of them done.
Sounds good. Let's do it.
Anchor. I feel
Siobhan.
like you're always on call.
Thank you very
The
much.
duty is off the flying.
Sounds good.
Excellent.
Have a good evening.
All right, so now we're finally down in the emergency department, and we're going to be seeing this new patient. So it's kind of cool. You get to see the ones upstairs, and now
Yes.
a new patient coming in.
And they get to see all behind the scenes.
Behind the scenes, yes, exactly. So before I see a new patient, I go in, look at their blood work. So we'll go see the blood work. We'll get a sense of what's going on, and then we can go and see them before actually writing the note and everything. Mainly just to see if there's anything like acute that we automatically need to do something about right now. Like, how sick is the patient?
Sounds good.
Okay. All right, done with that consult.
That took a lot longer than we anticipated.
It did take longer. It's like 7 o'clock now. But we weren't quite sure what was causing this patient's shortness of breath. And then you think like, okay, it could be lung, it could be liver, it could be heart. There's so many conditions that could be contributing. So, like,
We're gonna
you
dig
can
into it.
It's all the thinking, right? It's kind of
Yeah.
like Dr. House, right?
It is.
Yeah, yeah.
Perfect.
Okay, I can't believe end of the day already.
Me either. It flew by.
Yeah? Okay. I'm actually like, my mind is pretty exhausted at this point.
For sure.
But so what was it like, day in the life of a doctor?
It was very busy, very stressful, and I can appreciate things a lot more.
Yeah?
Yeah, definitely. I think my big take-home message from today was, understanding that, when I don't see you on the unit, or, we don't get an instant reply back to our pages, it's usually for a good reason. You're either in the ER doing consults, you're involved in your teaching, you could even be attending in code.
Yeah.
There's so many other areas in the hospital that you may be overseeing, and your participation, you need to be there.
Yeah,
So,
it's a lot of running around,
and I
eh?
know that regardless, you will get back to us.
Yeah.
And everything will be okay.
That is so true. Well, I hope that's true. It should be true. But either way, it was such a pleasure having you here, and honestly, it was awesome seeing patients together. Like, I wish you were always on our team. I mean, we are on a team together, and I'm gonna be seeing and working with you
Yes,
tomorrow, right?
Back on the floor tomorrow.
Back on the floor, exactly.
Perfect. Well, thanks for the opportunity. I really appreciated it.
Oh, my pleasure. And so if you guys want to see more videos like this or have questions, comment below, subscribe, and otherwise, we'll be chatting with you next week. So, bye for now.